Hey, Ryan. Are you drinking a beer out of a straw?
No.
Is it a crazy straw?
What are you talking about, man?
That's how you get drunk quicker. You drink beer out of a straw.
Hi, I'm Omega Rex W.
Hi, I'm Neil.
Hey, my name is Chris.
Hey, I'm Mark.
Hi, I'm Melvin.
Hi, I'm Matt.
Wang. Team Ayoko.
I'd like to welcome Nally and Wendy to our podcast.
Hello.
Hi.
They are
Hi.
in two different hospitals. And let's see what it's like out there in the COVID world. That's the God voice in the background. What do we hear on the news that's like not really reality? S'mores.
I think the one thing that everyone's hearing is just stay at home and it's going to be okay. People are getting discharged and they're getting better. But that definitely is not the case. Like the amount of discharged patients versus like patients who've actually gone off ventilators is such a different number.
That's the biggest thing that you would say.
That's the biggest thing.
And what would be the biggest difference from pre-COVID to COVID that you've noticed?
Our ratio sucks. Period.
What does that mean to people?
So like we just have a lot more patients, and I think a lot of things that you want to do that you normally want to do like on your checklist, you really don't get to do it. So it's kind of like you're doing your best to provide all this care, but at the end of the shift, like, do you feel like you really did your best?
We're just being stretched really thin. So like the expectation is still so high for all these nurses, but there's not a lot of manpower, to back it up, and it's no one's fault really. There's like way more sick patients than there are nurses.
What's the ratio? Like normally nurses get like 10 patients and now it's like 20 or what?
So Nally and I both work in an intensive care unit, like a medical surgical intensive care unit. So your normal ratio for critical care patients should be 2 to 1.
Oh.
But since the pandemic has started, we've seen 3.
Oh.
4.
I've had 5.
Double? Oh,
6.
dang.
So
I didn't have 6. I had 5.
yeah.
I had 8.
Oh, Jesus had 8.
Jesus had 8.
Jesus.
Jesus is our voice here.
Jesus is the man.
Yeah.
So yeah, like it's kind of you walk into your shift and you don't know what you're gonna get.
So I guess what's your opinion on New Jersey opening all these stores and other stuff?
Shouldn't do it.
Parks, beaches, and all that.
Shouldn't do it.
I think it's a little premature. I
Very
think
premature.
That's what she
that I understand everyone is super upset that everything was closed and our lives were kind of put on hold, but reopening this early is kind of just a slap in the face for all the healthcare providers. So I covered night shift for about 5 to 6 weeks, caring for the COVID patients during like the whole midst of the pandemic. I would come home from work and I was the word I like to use was restless. I couldn't sleep. I would work 12, 13, 14, 15 hours. I would come home exhausted and I would lay in bed and I couldn't sleep. So at one point, for 4 of the 6 weeks I worked on nights, I actually slept on the couch because I couldn't sleep in the bed with him. Because it was just a little like, I was really restless. I would lay down, I'm so tired, I just can't sleep though. And the only place that I was able to sleep at was on the couch for like 2 or 3 hours. And I would get up and go back to work and do it all over again.
All right. So my question is to, whoever wants to answer, but what was the range of ages that you had in terms of your positive COVID patients? Like, have you experienced patients that are really young? Because I hear now that the younger generations, like 4 or 5 years old, are getting infected, and obviously the elderly. So have you experienced maybe people in their 20s, their 30s, 40s?
I personally haven't.
The youngest patient I took care of who had COVID was 38. And that patient was on life support for 3 weeks.
Wow.
Yeah.
Did they have any pre-existing conditions prior?
35. Jesus had 35.
Jesus at 35.
35? Wow.
Yeah.
On event?
Yeah.
For how
Yeah.
long?
An event?
Oh, expired? After how long?
3 weeks.
3 weeks?
So Jesus took care of a patient who was 35 on life support, who unfortunately passed away after 3 weeks, who didn't make it. So it's kind of not a disease of age. Like you could be, I had someone who was 38, but I also took care of someone who was 91 on it.
Okay.
So there really does not discriminate.
Nope, it doesn't.
From experience, man?
Yeah, from straight up experience, bro.
Maybe we should talk about Matt, because I heard Matt had COVID.
Yeah, Matt, why don't you tell us your experience since you personally had it?
Oh yeah, I had everything except minus going to a ventilator. I mean, it was pretty much, I guess I would say it'd be a moderate case, but not a severe one, because I didn't even get admitted at the hospital because they said as long as I could still breathe, they're not going to take me. So I was like, all right, that sounds promising. But I mean, like, you know, I had like the lack of taste, smell, body pain, but I think that was just because I was stuck in bed, unable to move, couldn't eat, headaches, coughing, obviously, sore throat.
Yeah, you get yourself tested? Like, how'd you find out?
Well, I had a fever, and I thought I could beat it. Like, you know, I mean, like I sleep late, my shift's all over the place, so I lack sleep all the time. So I was like, all right, maybe I just caught like a mild fever. And then it was like 102, 103 for like 2 days, and I was like, all right, well, this is not normal. Usually I'd beat it within a day.
Oh, but did you actually get tested or no?
Yeah, but I got tested maybe the week after, but I already made sure to take off because with that said, like the next day I started having like very sore throat, a lot of more coughing, lack of taste and smell. And I was, you know, basically while this was going on, I'm reading the symptoms and I'm like, have like a checklist. I was like, all right, yeah, I got that. Okay, I got that. This is great, you know. And that was like 2 to 3 weeks straight. Or it was just like, you know, this is probably like the longest thing I've ever had. That's why it wasn't normal. Usually I beat things maybe 2 to 3 days. Usually my immune system will come back up, but I guess this wasn't the case.
Are you 100% now?
Yeah, I'm 100%. I took a couple tests. I'm negative again. But, you know, it's even with antibodies, there's still people saying that they got it again. I heard some stories from other people saying that they had it like 2 or 3 times already. Positive, negative, positive. So I was like, all right, well, who the
Did you get your antibody test, Matt?
Huh?
Did you get your antibody test?
Yeah, I got my body tested.
My body test.
He got his body tested.
Yeah, I got my body tested, and it works.
It works.
Who tested the body for you?
People.
Oh. All right.
So, like, I guess my question for you is maybe not related to COVID, but in terms of, like, becoming a nurse, right? Was there ever a chance when you chose your career that, like, life-threatening cases would have been, like, all right, that the possibility that you could die on the job or something like that ever occurred to you? I mean, like, I would think there would be, like, that negative thing where it's, like, you know, Ebola or something like that, like some random thing, but, like, obviously scarce, rather than, like, day-to-day feeling like, you know, there's this looming, like, monkey on my back saying.
I mean, yeah, like, yeah, right? I would take care of a patient that has, like, a contagious disease with no problem.
Yeah.
I would.
Oh, okay.
But let them have some bed bugs, because we get those.
Oh.
And those are the ones we're really scared of. It's just like.
They come in?
We can have patients come in and, like, it's like, oh, like, okay, we're going to rule out if they have tuberculosis. No problem.
Roll out anything. Okay,
No problem.
We'll go in there. But like bed bugs, it'll be like.
But you hear bed bugs or scabies, and I'm like, tape the doors, lock it, ring the bell only if, like,
You're dying.
Only if you're dying, ring the bell. I'm not going in there. No other way.
So the answer really is, like, not the life-threatening stuff. It's the crap you don't want in your house. Bed bugs and.
But where does it come from? Like the bed bugs.
We want to know too. Like, they get there. I remember one time I was in the ER, and this lady, they gave us a report, and they said, oh, there's something crawling in her hair, but we don't know what it is, so we just put a cap over it. So I was like, okay. So I was with another nurse, and she was just like, okay, I want you to stand over there. She's like, and if I yell, just yell too. And I'm just like, okay.
Yeah, I know who it is. I know exactly the story.
And then she was just like pulls off the cap, and then you see it like jump like on the lady's face. And she's like, ah! I'm like, ah!
So you're not in fear of your life then. You're just in fear of anything else.
Yeah, it was just it's a lot. It's weird. I think most nurses are like that though. Like we're okay with taking like the hard cases, and most for the aside from COVID, our hospital does a good job with providing us with certain supplies that we need to protect ourselves.
That's good.
So whatever it is, we know we got to do it. But them bed bugs.
I think the thing is just like when you become a nurse, you unconsciously sign up for this stuff. And
right. That's what I'm like. Yeah.
They train you to do it. You learn this in nursing school,
Okay.
but like actually seeing it, like no one. If you would have told me 5 years ago, like as I was graduating nursing school, hey, like in 5 years, like, you're gonna work in the middle of a pandemic, I would have been like, you're crazy, And then fast forward, here we are now. Like I'm still working in this pandemic now. Like I'm still taking care. I'm still working in a COVID ICU now every day, taking care of these patients. So.
Right, and everyone handles it different because I'm like reading these articles, like they're doing a lot to support you even outside, like in terms of your daily life with like discounts and like now I saw like the $10,000 like forgiveness and stuff like that, and trying to stop student loans, which is great. I was just wondering, how much of what's being asked of you was expected when you signed for the job.
Another question I have is like, based on the statistics that or we hear and what you've experienced, like how far off do you really think it is?
Well, there was like a discrepancy with the death reportings, I think, right? It was where patients who died of COVID, that's like one way to report it, like a patient who died of COVID, and then the numbers were getting mixed up of patients who died from COVID-related complications, and then it was patients who had comorbidities, then developed COVID. So it was just like there was like a mix-up of how it was reported, supposedly. So the death tolls apparently weren't completely accurate, because a lot of times like you have the patients who just have COVID, and then they end up, COVID is what's causing all of their secondary complications, but then you have patients who already have all their other comorbidities, diabetes, high blood pressure, high cholesterol, like COPD, then they get COVID. So, those things worsen the COVID, a lot more. Mm-hmm. So like I think the death toll was a lot off.
So the number's bigger.
But I think people died from COVID.
I think more people died from COVID and it wasn't reported.
So it's underreported.
I think it's underreported. Because I think like one of the nights when I worked, I think we brought out like let them rest in peace, God bless their souls. But like I think like 6 to 8 people died one night when I worked. And that's just like me when I was working nights, like within 7 p.m. to 7 a.m. That wasn't even counting the 12 hours before that, 7 a.m. to 7 p.m. That was what your dream was too. Overhead. Remember the overhead codes?
Oh my God. Yeah, I hear them in my sleep.
Oh no.
I hear them in my shower.
Yeah.
I have to like sleep with music on or something else, because if not, I just hear that's what I hear. Or I hear beeping all day. So like quiet has become like different. Like there's no peace in the silence anymore.
It's traumatic.
There's a lot of nurses that we work with who actually started seeing like online therapists.
That's good.
What? Really?
It's always good to see a therapist.
That's like was one of the
it's like the new PTSD.
Like one of the services offered to the nurses, like that you could see someone and it's covered for you.
Wow.
Yeah, because I can't imagine.
Yeah, more nurses are gonna need that, I think. To be honest.
They didn't sign up for that or didn't expect like this worst case scenario. I mean,
well, they're talking about a second wave coming,
Mm-hmm.
Oh, a second wave is definitely gonna come. I mean, like if you open things up, it doesn't. It's crazy not to think the numbers are not gonna go up. Like you can't level it out until you have.
This agrees with us that
When do you
a
think the
second
second
wave
wave is gonna come?
October.
October.
So Jesus is predicting.
Jesus is predicting.
So late.
Jesus is
Always right,
productive.
so.
I don't know. I think the wave is gonna come during the summer in the beaches.
No.
So what everyone's anticipating for is like what he said, like the fall. So it coincides with flu season and pneumonia season.
Ah, yeah.
And that actually is the worst season in the hospital, those winter months, because we have so many patients who end up like COPD exacerbations and they end up having pneumonia, and it's really hard to take care of these really sick patients.
Ugh.
So now in combination with the COVID, it's going to be very interesting.
Do you think nurses are just gonna, like, new nurses are gonna quit?
Well, new nurses, some of them, they don't have to take their NCLEX, right?
Yeah, they're getting put in already.
Fast track.
I'm serious. I read an article.
Part of it's getting waived. Yeah, a lot of the nurses that
So, like, I don't understand, though, because, like, if I'm a new nurse and you're telling me I don't have to take my boards and I take care of these patients, you're not coming to me a year later talking about you got to take your boards. Like,
I think that's a little like, that's a big liability, though, that these nurses don't have to take their boards. And that's true. But
that's the basics.
I also think it's a little unrealistic that all these new nurses coming out of school are just going to deal with COVID patients, though. Like, I'm seeing that now, like in the ICU, like they're training these new nurses. So now all they know is only how to take care of COVID patients. And I'm like, that's the worst thing. Like, their whole orientation is just taking care of COVID patients. I'm like, okay, what happens when you have a patient who comes in with a brain bleed or like a stomach bleed? Or, like, you know, any other thing in the world. Like, you work in an ICU, you're going to get a touch of everything. You're not going to know what to do.
But I didn't even think about that. Like, if they're not taking their NCLEX.
I actually didn't hear that, to be honest with you.
Oh.
I just think that's bullshit.
In California, they're doing something like that. It's kind of like they'll allow you to fast track, but they're looking more for the people who are just newly retired nurses to come back.
Ginny?
They're looking for retired nurses to come back and help?
Yeah.
Yeah.
the money's there, yo.
Yeah,
Get
but
that
if they
money.
retire for a reason, you know. Or maybe, but what on the flip side, what if they retire early because they're like, they don't want to put their lives in danger because of this?
Another thing that they're doing is if you're in school, like you're in nursing school, they are not allowed to fail you out of the program.
Damn, this is a great time to get
I was
A's.
just talking to, I legit just earlier, her sister failed something last semester, so she's taking again this semester, and she's barely passing. But normally in nursing school, you can only fail 2 classes.
If not, they will remove
and then
you
you're
from
getting kicked out. But no, and this is Rutgers, Newark.
I wonder if that works for accounting.
Rutgers, Newark.
I want to be that patient.
You can't
It's
fail
very
out.
scary that I understand there's a nursing shortage, but now you're really bringing these new novice nurses out who have 0 experience, and there's a lot of expectations for them.
Or they shouldn't be nurses.
But that's why.
Well, no, like they should be nurses, but it takes time to go from, you know, like what you learn academically and applying it to real life situations. So like I've been a nurse 5 years. How long have you been a nurse?
I don't know.
Exactly. She doesn't even know. But like,
What is it, like trial by fire?
Like, how long after you started working did you actually feel comfortable working?
Yeah, like just recently. Because before, like I would, like get to work extra early and look this up and do that. And like now it's just like you can call me last minute and be like, come in. I'm like, okay, I'll be there. And then it's like whatever you get, I'll be able to deal with it.
Oh, sorry.
But before it's just like you got to get there extra early, print this out, look this up, ask this person. I mean, it's different now.
Yeah, do you think they're gonna last though?
These nurses? Probably not. But
They're
I
gonna
know
burn out, right?
one of the concerns they were saying about failing out of this program is you don't know what this family hardship is through. So like, what if their parents can't afford school and this and that? Which I get it, but if you're not making the grades,
that's someone's life that you're gonna be taking care of. Like ultimately, you get in, like now, like kind of what Natalie said. you kind of get in now, and the goal of the day is you keep these people alive. Like, you do what you can to keep them alive. And honestly, at the end of the day, that's sometimes what really helps these patients, like the type of nurse who takes care of them. You can have nurses who don't know what they're doing, and this patient can honestly really decompensate in like a blink of an eye. And then you can have a really experienced nurse taking care of them, and like that's what's going to make the difference. That's where you kind of teeter, where like you're going to make it or you're not going to make it based on who's actually providing the care for you. Because nurses take care of the patients.
What'd you say, Jesus?
12 and a half hours a day. Like, I spend the most time with the patients. We do.
But is that not taken like into consideration? I mean, I understand there's like there's a lack of personnel, but that fact alone, like, what's the point of it?
So as a patient, should I ask?
Yeah.
Be like,
How long have you been in there?
how long have you worked?
A lot of times.
Well, no, because you could get somebody who's been in forever and still suck.
So should I ask? So the best question is not how long have you worked, is it do you suck? Like, can you honestly tell me you suck? Like, is there like a test question I can give them?
Sometimes like I still have patients, like, they look at me and they're like, oh, like, you look too young to be a nurse. Are you sure you know what you're doing? And I'm like, yeah, I've been doing this 5 years. If not, like, I can request another nurse for you.
That's crazy.
You know?
I don't think I'm approachable at work for them to say that.
She's not very approachable at work.
They wouldn't say that to me. They would probably tell their family members they wouldn't feel comfortable, but I'm not like
at work. If I'm taking care, I walk in, I'm like, hi, my name is Wendy. I'll be taking care of you today. I'll be your nurse. If there are any questions, let me know. Bright, early, and chipper. Up at 5 a.m. Had my coffee. Nally though, she walks in and all she says is, I'm Nally. I'll be your nurse. Hit the bell if you need me.
No, I'm a little bit more nicer than that. I ask them, like, how was their night? If they start talking and they breath smell, I'm like, you want to clean up?
Whoa.
I'll help you, but like,
You carry Tic Tacs and stuff?
Of course.
You got like gum and shit?
Actually, she has this little bag that she has
Banaka?
at work that has everything in it. Everything you can think of is in this bag.
Because when they be
Deodorant?
I don't want to smell that. I don't want to smell that. So we gonna freshen you up together.
Time out.
Is there like a nice way to say it? Be like, yo, I don't know if it's because you're sick, but you smell.
No,
I just like you gently offer, like, do you want me to help you?
No, this is what
Would you like a mint?
This is what we
set
gonna
you
do.
up to.
I got this new medicine called Old Spice. Like,
This medicine.
you just gotta lift up, and I'm gonna apply it.
So there's been a lot of talks about comparing the coronavirus with the actual flu. So they're saying that during that whole pandemic, when the flu was like a total outbreak, that they didn't do a lockdown like they're doing now. So what makes the difference between the common flu to coronavirus? Like, why is it that the government is shutting down everything based off of this, I guess, specific virus, flu? Like, what's the difference? Like, why is this one a lot worse than the other when they're showing statistics that the flu is actually the worst, but they didn't do anything like this during that time?
I think now, like, we know what the flu is now. We don't know what it was like when the flu first came. So
okay,
we're in the beginning of Corona now. And the flu, I think, is just as bad. We don't really enjoy taking care of, we take our precautions with them. But I mean, you got to think about it. Now there's flu vaccinations, there's different medications, and we're just not there yet with the corona. So we're noticing the corona from the beginning and on, where our age group, we just know the flu as with preventative measures. We don't have preventative measures for the corona as of yet.
Interesting. So you think that corona, like a year from now when we get a vaccine, like it'll come back and it's something like every year we need to get a vaccine for?
Well, the corona has a lot of different strains. So if you actually look on the back of your bleach bottle or the back of like your Clorox bottle, it actually like those wipes are bactericidal, virucidal. And if you actually look, corona is listed on there.
Yeah.
So that's why it's called COVID-19, is like this, like the strain of it that makes it more deadly. So just to add on to what Nally said, about how we really don't know much about corona yet. another thing is that the corona, how it acts differently than influenza, is that it's attacking multiple organs in your body. You know, these patients that come into the hospital, some of them are showing with cardiac issues. They all have lung issues. They're showing as, they're having kidney problems. A lot of them end up on dialysis. They're going into liver failure. A lot of these patients, they are the virus is attacking their lungs, so they're actually deprived of oxygen even longer. Okay, so like when they do wake up, sometimes they're not fully with it.
Crazy.
Another thing about the corona is the corona's been around for a while, and it's actually a virus that is common within pets. And the way coronavirus manifests in these pets is that it's a GI problem. And there's a vaccination. So if you have a dog, most these people, they know about it because their dogs get a corona vaccination. But the way it crosses over to the humans, it manifests totally different. And I mean, we do still get that GI discomfort as far as like diarrhea and everything, but that's really in animals, that's what it is. And it's one of those things too, like if your pet gets it, it really moves fast for them.
So have you been seeing it mutating? Like, was it first just all respiratory and then now it's like kidney stuff, or?
I think we're learning.
I think it's always been there and we're just learning.
Okay.
But a lot of times, like these patients, like for me personally, I'll get a patient who just got into the hospital and they have a positive COVID test and they're on like a ventilator. And then like all their labs are definitely all mixed up, all out of whack. But for me personally, the first thing that happens is they start going into kidney failure. And then they go, and then, we're watching and we're trying to treat the kidney failure, to prevent dialysis. But then ultimately these patients do end up on dialysis. And while this is all happening, all these patients are also going into liver failure as well. So like those are the two organs of your body.
What else?
That
cardiac? Jesus said cardiac.
After activation.
After activation though.
You get that a lot.
No, well, okay. Well, hold on. So for my patients with the kidney and liver failure, they cannot remove the waste from their bodies because like that's the function of those two organs. Right. So all these electrolytes end up building up. So like for me personally, I had a lot of patients who their potassium was really high and that causes your heart to stop beating. And that was one of the things that, despite dialysis, they were still expiring from these issues. But what Jesus mentioned is that patients who were able to make it off the ventilator develop cardiac issues afterwards, which is very much true as well. There's been there have been like cases where patients were showing up to the hospital and, complaining of chest pain, like all the corona symptoms plus chest pain. And, we do like their EKG and they show like, an ST elevation, which means that they could possibly be having like an actual heart attack. But turns out that coronavirus can cause those ST elevations. So is it like, so now it's masking, like, are you having a true heart attack or is it just a corona?
Oh, that's a good,
so I think
good thing. Yeah, that's interesting.
The testing, some of these people are testing negative when they're clearly positive.
I think that's what's scary too, right?
But it's definitely like on the person who does the actual swabbing. Because you have to swab properly.
Oh yeah.
Because we knew of someone who had all the symptoms. Jesus had all the symptoms of corona, and he actually got swabbed for corona, and he turned out to be negative. However, one of the diagnostic criteria for corona is the swab, and you also want to follow up with a CAT scan of their chest to see bilateral infiltrates, right? Like gunk in the chest. So his CAT scan was indicative of a COVID-19 infection, but his swab was negative. But he was out of work for what? Like you say, like 2 weeks? He was out of work about 2 weeks. And I know this for a fact that he looked like crap and felt like crap because I delivered food and medicine to him for those 2 weeks.
And Lysol spray.
And Lysol spray for her. And I actually showed up to check his oxygen level multiple times.
With alcohol.
with multiple times, I showed him to check his oxygen level to make sure his oxygen level was above 92% to make sure that he was safe at home by himself.
Nurses, there's nurses' bags.
No,
Yeah.
Jesus.
Right.
Oh, because it's Jesus.
We gotta protect baby Jesus.
I'm sorry.
Yeah, and speaking of like the swabbing though, like I went to a site where you had to swab yourself, and if I hadn't had that happen to me by a professional before, and you know you did it right because you feel like you scratched your brain.
Yeah.
All these tests are negative for no reason because people ain't swabbing up properly.
All the way back.
You gotta lean your head back and then like shove it in there like violently.
So you
and
think
then like when you feel like it's poking the back of your eyeball, like you got it. And then maybe like a little bit more.
So
you gotta leave it in there for 15 seconds.
Man.
But like try to ask an average person to do that to themselves. No. So like there's these sites coming up right now, right? And I just went to one. Not to name names, but like they had you do it yourself, and I'm just like, yo, if no one knows how to do this properly, that is negative as for everybody. Like these numbers are wrong.
I knew a ton of nurses who
got false negatives.
So, for example, my best friend, unnamed individual, she definitely had coronavirus, and her swab was negative, but she went to the emergency room because she started to experience some shortness of breath, and she was prescribed the initial like testing medication that they were giving, Plaquenil, and after she had Plaquenil, she felt so much better and her symptoms went away, but her swab was negative. And recently, she actually got tested for antibodies, and she was positive for antibodies.
So meaning she has it or had it.
She had it.
Yeah.
She had it.
Yep.
So there are cases where patients are testing negative, but definitely are positive.
So do you think that the patients who were tested negative, you think it's because they were swabbed incorrectly or they are a true negative?
There's a possibility, like if you don't know how to swab the right way, and to be honest with you, like these people, did anyone ever teach them how to swab the right way?
Back then.
True.
For us, say like if you're in the ER now and you're an ICU admission, because we have a clean unit and a dirty unit, a COVID unit, you get swabbed before you get admitted to which unit. So the turnaround time is an hour now. So they won't admit you to the ICU unless it's a negative thing.
Yep.
Because we started doing open heart again. So it has to be a clean unit. So remdesivir, what Jesus is talking about, is a new experimental antiviral drug that they're currently using to treat these COVID patients. But it's associated with the Mayo Clinic. So you have to, as a physician or a practitioner, you have to contact them, send the information over, see if your patient is a candidate to be a part of the study, because it's an experimental drug. And then, like say if they're like, okay, great, like your patient is a candidate, then we administer the drug.
Also constant blood work and urine and all that.
Yeah. And then after that, like they get monitored really, really closely because it's a part of a study right now. Kind of like how Plaquenil and the azithromycin was a part of a study. But it showed that those two drugs didn't really do anything for the corona. And they actually were causing more problems because of their side effects.
Oh, really? Huh.
Yeah, that's why like a lot of the patients who were, say like you called your doctor 2 weeks ago, like, oh my God, I'm so sick, can I have the Plaquenil? They wouldn't have prescribed it to you because of the side effects. Like being on these drugs, you should really be in a hospital, like definitely Plaquenil.
So are you still using these meds like currently right now? No.
No.
They removed it from the protocol.
No, but I'm saying like the last couple of times that I've worked,
they took it off the experimental list. It's out of the bundle now.
So the last I think just for the essence of time, kind of just to wrap up, like I think the big question here would be, what, as professionals in the medical field, like what do you see would be a realistic time frame for things to go back to quote unquote normal? Because I've read an article, it was like 5 years.
I don't know about 5 years.
Well,
but I just feel like no time soon.
I just think that people kind of have to look at the bigger picture. Like a lot of these people are saying, open up the economy, open this and that and the third. And I completely get that. Like, believe me, I want to go to Marshall's and I want to go to TJ Maxx and spend money. Believe me, I really do. But until you've had someone in your family affected by this, or unless you've had to hold a dying person's hand because they have no family around.
Or if you call Jesus on FaceTime and he's pale as talking about I'm okay, and it's like, listen, I'm about to take this drive up to your house, and if you don't open the door, I'm gonna it up.
Well,
because that's how it was, though. Like, you know,
and it still is right now. Like in the hospital, how these family members are saying bye to their loved ones, it's through FaceTime, and that's honestly not like. How would you feel saying goodbye to your grandma, your grandfather, your mother, father, aunt, uncle through FaceTime? Because
I had a patient. I told you, right?
Mm-hmm.
That so I'm sitting here, and this is, you know, the patient here, and I'm holding the phone like this. So my patient looks horrible, and the family member, I can see them, they can't see me, and they're crying, and I'm just supposed to be okay. It was just like to the point where I had to put it on mute because I'm sniffling. Like I'm watching you say bye to someone. Like,
Right,
And then, you know, we had another nurse that was there, your best friend, and she's just like, I'm like, I can't get nothing out of my mouth at this point. I'm just like, oh my God, this is so heartbreaking. And she's just like, I'll be your hands and I'll be your words, and, you know, really trying to console these people. And it's heartbreaking. Nobody should die like that. And then you're also getting these new nurses that don't have to take NCLEX and don't have to do anything. I kind of feel like with nursing, you learn how to be more human and more compassionate.
You learn how to be a nurse when you are a nurse.
And a lot of these people that are coming out like that, like they don't get that. And you know what? I could be a bitch sometimes. I know it. Great. But
Jesus
when it comes to showing that compassion to my patients and my patient's family, like it's an on and off switch. And a lot of nurses, you're coming out of school and they're putting you on these units without the experience, without the knowledge. What are you going to lean towards? Are you going to remember to be compassionate? Are you going to remember that this is somebody's mom, their brother, sister, mother? I said mom, father. It's hard. It's emotional.
It's emotionally tolling on these people who are saying goodbye to their family members like this, because a lot of these people, the last time they saw their family members was home, and then the next time they're going to see them is in a coffin.
Or not.
If they can.
If they can, a lot of these funeral homes aren't letting them do open casket viewings. They just have to be, you know, like it's from hospital, funeral home, coffin, 6 feet under. So honestly, it's like, would you rather be 6 feet apart right now, or would you rather be 6 feet under later?
Right.
So it's really sucky to say, but like, if you didn't experience it, you don't truly understand. Right. You know, if there are literally times where, like, Mel can attest to this, like I'm home and like I'm like so anxious because I'm like, oh my God, like I took care of this patient yesterday. He was doing so bad, like I don't think he's gonna make it. And I wonder all day if my patient made it. And then it's like the worst feeling when you come back and you purposely look for that person in that room and they're not there. And like your worst fears are like confirmed. They're like, this patient didn't make it and they were alone.
Yeah.
Okay? Because the one thing that for me personally, when I sign in at 7 a.m., and I always tell my patient, like, I'm your nurse, you're with me now, so we're family. Like, no matter what, like for the next 12 hours, your family can't be here, but I'm here with you. Like, I'm attesting for all of your needs. So like, can you imagine like 12 hours after that, you're checking out, you're coming back later, you're coming back 2 days after that, and they're not there anymore. So it's not just emotionally tolling for these families, it's also for these nurses, kind of like Natalie said, like how many times do you think we can hold a phone or an iPad to these patients who are dying, to their families, and us not be affected by it? Like, we're not robots. We have feelings, you know, we come home to our families, and half the time, like, you can't even tell your families about it. They don't understand. Like, for me, I come home, like, every time I get out of work, the person I call is her. Because I don't want to come home and tell Melvin how my patient died on me today. You know, like it's not fair.
No, yeah.
And he wouldn't get it, you know, like he can be there for me, but he doesn't really truly know what I went through, but she does, because I know she's going through it too.
Walking into a trailer of bodies, stacks of 3 on each side, is no joke.
And that's another thing that people don't realize. They think like, oh yeah, these patients are dying of COVID because they had this, that already. No, like there are patients who are dying just from COVID. And then you walk into, you know, and then it got to a point where the morgue was overrun with patients who passed away. And then now we're having refrigerated ice cream trucks. They
didn't keep them. They didn't keep them refrigerated, right?
Mine was refrigerated. Mine was refrigerated.
I went into one of those.
Once you open that shit, it's like
it hits you.
Yeah, that cold air of dead bodies.
Well,
so can you imagine walking into a trailer? You're bringing
3 by 3 on each side?
Dude, 3 stacks of bodies each on each side, going down the hall.
So is that a joke? Where your morgue, you don't have enough room in your morgue, so you have to hire a truck outside of your hospital in the back to put patients' bodies.
Yeah,
that's the economy not worth it. Like, you're not worth it.
You're like, no, nothing is worth that. Like, and I think that's what changed it for me, is when I had to bring someone to the truck. What you see there, you should never have to see, because that's what you think about.
Just to wrap up, is there any words that you want to share with whoever our viewers are going to be for this?
So the next time, for anyone who wants to be a nurse, and the next time someone ever tells you you're just a nurse, you are not just a freaking nurse. You are the reason that patient's not going to die today. That's what it is.
But you're more than a nurse. You're an extension of their family. Like, you have to take on, right? Like, you're just you're everything for that one person.
Kind of just,
if you need me to be Jesus and hold your hand, you know, like you're really everything. Like, you are possibly the last person they're gonna see. And like, I had a patient where this family member wanted to FaceTime there, and they were so nice to me. Whenever you get a chance, we know you're busy, and I stayed after I got off to FaceTime them, because I'm like, I can legit go home and this patient can die and their family can never see them. And it just takes that little extra dedication. I mean, they paid me for the extra time I stayed too, but it really does take, you know, a type of heart for you to do the extra. Because a lot of people, they'll be like, oh, it's time to go, and they're out. And it's just like, that's not what nursing is. Nursing isn't, I think one big thing they stress for nursing is time management. And you have to realize, yes, you have to manage your time for your patient, but your patient really, for those time, is your everything.
And another thing is, it's not for the weak heart. A lot of times these people, they get into it because they say it's about job security and the money. No amount of money is going to be worth what you do. Nothing.
True.
Not the money. I'm still broke. We're still broke people.
They're not paying you more. Crazy.
That's another conversation, Chris. There's no such thing as hazard pay.
Part 2.
No such thing as crisis pay. We're still getting paid the same amount.
But we still show up.
But we still show up every day. And honestly, like, I show up knowing that I possibly could get corona that day. And I still show up. Because, you know, it's what I do. That's what we all do. So the next time you're sick and you don't feel good,
or the next time you want to go to the beach or go to the mall, or go to where else are they opening? The movie theaters.
Yeah, I'm staying in place for like the next 6 months.
I'm right here.
I'm
staying home.
Yeah, me too. Yeah.
So you don't know, you don't know that Chris hasn't left his house in like almost 57 days.
Chris has been getting his groceries delivered too.
Instacart.
Yeah, I haven't left my house.
Chris, are you going for the record?
You do want to get out the house, but if you do get out the house, really protect yourself.
Be safe.
Be safe. Practice social distancing. Don't be all up under people.
Wear your mask.
Wear a mask.
Drop the gloves.
Oh my God.
Do not wear gloves. You are spreading more germs with the gloves
They
than
look
anything
cool though.
else. Because you wear the gloves and you're touching the table, you're touching your phone, you're touching everything inside the grocery store. And then what do? You accidentally, for women, you go like this. You're like this to push your hair back, and you just put all those germs
and
on
then
your
you come
freaking
home
face.
and they'll be like, hey,
Oh, you gotta shave your head.
but now it's all on Mel.
And then what happens? You come home, your children want to kiss you, and what are they kissing? All those germs, all from those freaking pair of gloves that you're wearing.
Let's just wear one glove.
No gloves.
Heard it
Like
here
Michael
first.
Jackson. Just one glove.
Okay, no gloves. You got it.
No gloves.
Fingerless gloves.
And sanitizer.
Hand sanitizer, and honestly,
soap and water.
wash your freaking hands.
Soap and water.
Mittens.
Wash your freaking hands. And the best way, sing happy birthday while you're doing it. Happy birthday to you.
I'm a savage. Classic. Sing that one too, right?
It's 20 seconds?
Wash
All right.
your hands for 30
Oh
seconds.
my God.
Okay,
Right.
that's the way to go.
Well,
Where's your cup?
we would like to thank you for your service, including you, Jesus, in the background.
Thank you.
Thank you, Jesus.
Jesus.
Cheers to you both, and Jesus.
Cheers.
Word.
Cheers.
Thanks again for your time, and we'll see you next time.
See ya.
Yep.
Thanks, guys.
Hi.
Yeah, Brian, I can barely hear you, bro.
And he was like, you want to come in and be charged?
but then at the end of like 6:30,
It's that $20 mic, though.
I know.
Yeah, I got antibodies.
Well,
So it's a negative.
Is what that means.
Can you mix it with our ramen when I pick it up? Just like cough on it or something.
Just cough. I don't think that's how you pass antibodies.
Is that how bodies work?
Can you lick it or something? I don't know.
Yeah, I like it.
What else will you lick?
They're a fun bunch.
I want to know what else he's gonna lick.
Whoa. Cheers.
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 Wendy's supposed to have some of this tequila.
Cheers.
Cheers,
Cheers, Mel.
Where are you?
Don't be a douche. Cheers.
Juicy ass is your beer?
Ass.
Brian got juicy ass IPA.